everyone, and welcome to Medical Mafia. I am Greta Crawford, founder of ProtocolKills.com, and I'm an educator of patient information, patient rights, and informed consent. And I got started by being a patient myself. And so, with that being said, I want to go in and talk about tonight's show. Tonight, we are going to bring you some information about organ donation, organ harvesting, and what it is to be deemed brain dead and what all that means. I've been doing the research on this, and let me tell you, I kind of feel brain dead from trying to research all of it. It's like a lot of information, but that's why we have an expert on this tonight. And her name is Dr. Heidi Klessig, and she's going to help us understand what is actually going on, all the misinformation, disinformation, and what's driving this. And I think we know what's driving it. The name of the show is Medical Mafia, so we can, come up with some kind of idea. For me, the only true way we can find informed consent is through available knowledge. And we can't expect to get knowledge from those who control the outcome of our care. We just can't anymore. These people work for the system owned by those driven by financial interest and not the well-being of patients. Knowledge is either limited, controlled, hidden, or denied. So you can't get informed consent really anymore from your doctor. If they don't have that information, how can they give it to you? Or if they're not willing to seek out the information for themselves, then how are they going to be able to give it to you? If what they don't have, they can't give. And so doctors, it seems like, because they're in this system and they have such a grip around them, they no longer are thinking independently or logically. And we have to ask, what are they doing? Like, are they following the laws? Are they following moral principles and ethics? Do they follow influence? What is driving? Is it fear driving them? Fear of losing their job if they don't do what something is, told to them to do? What's driving this? And we need to find out, where are the facts and the logical, critical thinkers at? Who's willing to step up and, push against the system and actually help patients? There are people out there who are willing to do that. They may be hard to find, but they're there. And we have to be knowledgeable enough to know where to look for them and seek them out. The best means of gathering information is to inform yourselves now about as much as possible. Step away from the TV that is doing absolutely nothing from you. Put down the social media unless you're trying to educate yourself on something. And seek out people like our guest tonight, Dr. Klessig, who has no financial ties to the industry. That's what's important. She's not here to make money off of you. She's, not here to make money at all. She's here to give information because she genuinely cares about people. Seek out people who work independently from the system, like my guest last week, which was Dr. Mary Tally Bowden. She doesn't take Medicare, Medicaid, or insurance. She is paid by her patients, so she works for her patients. And a lot of people get mad and they're like, well, she doesn't take insurance. No, because if she does, then that influences her ability to treat you as a patient. It not only influences it, it constrains her. She's only able to do the things that they allow her to do. And being, a patient herself, she said she was pregnant for 5 years straight. So she knew about being a patient. And she said she didn't like it. She didn't like being in those constraints, and she didn't like it as a doctor, and she knew the patients didn't like it. So that's what we have to do. We have to seek out people who are experts in their field, but at the same time, they're not controlled by the system. Also look at websites like protocolkills.com and ouramazinggrace.net. Scott Shearer was also a guest on my last show, and he has so much information on his site. He learned so much from his experience as I did from mine. And we both took a lot of time and effort researching it, not just to find out what happened to us, because we could have done that and then just said, man, that really sucks, and not gathered it and put it into a website for everyone to see, and then for others to find. Also, look into the intent behind those providing the information. Are they giving you information to earn financial gains or to elevate themselves? Or are they giving you information because they are doing what is right, because they truly want to help you? You have to know what the intent is behind people. I provide information without any financial ties or gains because I feel that God has called me, along with others, to be a watchman. From my own personal experience, I know I need to warn others. And the reason being is, if I've been through this experience and I know what happens and I don't warn others, it's right there in the Bible, the blood will be on my hands. I will be the one held accountable for it. But if I know this information and I get it out there to the best of my ability and I warn God's children and everyone else, and then they choose to, reject that information, well, it's free will. They don't have to accept what I'm saying. They don't have to believe any of it, but they have been warned. And then if something happens to them, well, then the blood is on their hands, So I hope this information gets out to people that have ears to hear and eyes to see and are willing to accept it with an open heart, because it truly will be life-saving information. And that's what Medical Mafia is about. It's me and being obedient to God and serving him and doing his will, and having people on that are trying to do the same. So with all that being said, before I bring my guest on and give her introduction, I want to go really quick to the first break. And on this break, I want you all to find out that I was explaining to her, this is the Street Talk Network. We're here to provide information to people at, no charge. We don't have a paywall or anything like that. So the Street Talk Network provides information every day of the week through chats, through shows. And so we're going to take a break real quick, and you'll find out where to go to see all the links and areas that you can go to get more information so that you can protect yourself and be better informed. And we will be right back. Welcome back. And I didn't want to pull out the glasses, but I need to because I don't want to screw up her intro. Okay, so tonight's guest, Dr. Heidi Klessig, MD, attended medical school at UW-Madison, where she completed a residency program in anesthesiology. She received the American Board of Anesthesiology's board certification in anesthesiology and the ABA's Certificate of Added Qualification in Pain Management. She was a founding partner of the Pain Clinic of Northwestern Wisconsin and an instructor for the International Spinal Injection Society. After her husband was diagnosed with a brain tumor, she retired in 2007 to devote time to her family, homeschooling her 2 children. I understand that. I have a homeschooler all the way through high school, and I have a high school homeschooler, and caring for her husband, Daryl. She now writes and speaks on ethics of organ donation and transplantation. And so, with that, Chris, go ahead and play the intro for Dr. Klessig.
I'm Dr. Heidi Klessig. I'm a retired anesthesiologist and pain management specialist and the author of The Brain Death Fallacy. His monitor showed he had a beating heart. He was breathing, with help of a ventilator. And they told me this man was dead. They say the burden of proof regarding the ethical and legal propriety of this practice is not enough. These people who tried to do the most wonderful thing and donate in New Jersey, they gave her a feeding tube, they gave her a tracheostomy, and guess what? Jai began to improve. We live in a world of information available at our fingertips, and knowledge begets change. In our zeal to provide more viable organs, we are ignoring the respect due to the humanity of these donors, treating them as commodities, and forgetting that our role as physicians is to heal, not harm.
Hi, Dr. Klessig. Thank you so much for joining us tonight.
Thank you so much for having me on the program. I really appreciated the introduction that you gave earlier on in the program about fully informed consent for people. And that's why I do what I do. People go and they are getting a driver's license at the DMV and someone with no medical training at all asks them, do you want to be an organ donor? And there's no consent form that people say, well, sure, I will. And they get signed up and there's no informed consent. So that's why I'm here. Thank you so much for having me on the program.
Great. And this is exactly why I wanted you on, because I know that you're coming from your intent, because I talked about that. Your intent is to help people. And, we all have free will. We can decide any way we want to. I'm not advocating for, no one should become a donor. What I'm advocating for is that people should be well informed about what's going on and the drive behind some of this and the true definitions and meanings of these things. And like you said, people don't understand what is going on. All they hear is, I'm going to do I'll be dead. It won't matter. I won't have a care in the world, and I'll be doing something good for somebody or several somebodies. I can save 4 or 5 people, but they don't understand the details behind this. And I think tonight's show is really going to wake people up. And like I said, you can still have that free will of choice. You may just want to, send in your paperwork a different way. As far as, I have paperwork on protocolkills.com that you can specify how you want your current healthcare done while you're alive and able to make decisions. And then how you want your healthcare after that. Maybe there's certain things that you want to change or specify that, you can assure yourself to the best of your ability that you're doing the right thing and helping somebody, but also protecting yourself. Because what we found out is a lot of people aren't being protected. So I'd like to go in first with your story and how you became involved in all of this.
Sure. Back in the late 1980s, I was a resident studying how to become an anesthesiologist in a training program. And I came in for night call one night and reported for duty. And they said, Klessig, glad you're here. We'd like you to go up to ICU. There's a brain dead man up there. We'd like you to bring him down for organ harvesting. And I sort of gulped because, I sort of remembered hearing about brain death somewhere along the line, but I did not have all the facts at my fingertips. So I asked him, I said, brain death, huh? Is there anything different about this case that I need to know? And the man just sort of rolled his eyes and laughed. He said, just be sure someone has actually declared him brain dead. You know how eager the transplant team can be. Well, that wasn't what I wanted to hear, right?
Yeah, that's a red flag right there. Like, that alarms would have been going off.
So I found that very confusing, but I went up to investigate further, I found my patient up in the ICU. He was a young man about my own age at the time, and he had been in a motorcycle accident and had a very severe traumatic head injury. And yes, the neurologist had indeed declared that he was brain dead. So I went to look at my patient, and funny thing, when I went in the room, he sure didn't look dead. He was lying in his bed. He was warm. He was pink. He was, breathing with the help of a ventilator, like so many ICU patients. He had normal blood pressure, normal heart rate. He had nearly 100% oxygen saturation in his blood. I mean, he looked like every other ICU patient I'd taken care of, and in fact, better than most. Mm-hmm. So I took these facts back down to the operating room, and I found the staff anesthesiologist who was going to be supervising me for the case. And I presented the facts to him, and he said, all right, what's your anesthetic plan of care? And at that point I was, sort of brainwashed myself, I guess. I was being trained to think a certain way. So I said, well, I'm going to give him a paralyzing agent so he doesn't move during the surgery and upset the surgeons. And I think I'll give him some fentanyl, which is a potent painkiller, so that he doesn't have swings in his heart rate or blood pressure that might damage the organs. So then my staff anesthesiologist looked at me and said, are you going to use a drug to block consciousness? Well, I was sort of stunned. I asked him, I said, why would I do that? Isn't he dead? And he just gave me this long look over his surgical mask, and he said, why don't you give a consciousness blocking drug just in case? And he walked away.
Just in case.
It is to my regret. I am so sorry looking back at it, because it didn't make sense, right? It doesn't add up. Why should a dead person need anesthesia at all? Why should we have to worry about them possibly being conscious and having to give consciousness blocking drugs just in case? But, to my shame and regret, everyone else was going along with it. So I did too. I did what I was told. And I brought the young man down to the operating room, and I gave him the anesthetic we had discussed. And I'm here to tell you, he reacted to the incisions, to the bone saws, to the organ removal, just like anyone else. He required the same types and amounts of anesthesia as anybody else. And so, looking back on it, I can tell you, honestly, that man was in no way dead. I told this story to a friend who is a pathologist, and she said, Heidi, when I take out organs in the morgue during an autopsy, I don't have to give any drugs at all. So really, it's my regret over this incident that motivates me to be speaking about this with you here today, and motivated me to dig in further and to try to find out, where does this idea come from?
Right. And that's the thing, when you had like an aha moment where, well, hold on, the people in the morgue don't have to use all these drugs, and we know they're dead because they're in the morgue. Why do I have to use them? And that's kind of, I think that was your moment where it kind of clicked, huh? Yeah. And we all have those moments, because you're right. We are in a way trained to follow along, and if something happens, we go to the emergency room and we do whatever the doctor says. And I've been there. I've been questioning in my mind, well, this seems odd. Why is this happening? Why is that happening? But yet I still go along with it, because well, they're the doctors, they're professionals, not me. And but then we have to remember that, and looking back myself, before they were doctors, who were they? They were just humans. They're humans while they're doctors too. And that's the problem with people, is we think that once we get a title on somebody and give them a certain amount of authority, that they transform into something that is, unapproachable, that, they have the ability to do no harm, to do no wrong, just because of the title they hold. And that's not true. They're still human. They still can sin every day, like all of us. They still can make mistakes and have problems like all of us. And so when we step back and say, wait a minute, we're all human. We all make mistakes. We all fall into the trap of temptation, fear, greed, whatever. All of those things can affect us, and they can affect our judgment and our decision making on ourselves and on others. And so when we step back and we look at it that way, then we have to say, okay, I need to start questioning. I need to start finding out the truths and the facts, because maybe this person who is supposed to be taking care of me is not as informed as they should be, or that they are even aware they should be, And so I want to go, like I said, I was telling you about, this is the Street Talk platform. And so we want to break it down on the most simple level as possible so that everyone can understand. And I think the first thing that I want to bring up is the definition of brain dead. And so Chris, can you pick one for me up? And tell me if I'm wrong. These are some ones that I looked up, but irreversible loss of all brain and brain stem function, often leading to organ donation. It was funny how they put that organ donation part in there. And then a patient must be on a ventilator to be determined brain dead, which I went back and forth trying to figure that out, because, one search it would say yes, and one search it would say no. And then in one search it said yes and no. And so I was like, I'm just going to have to ask the doctor on this one.
Yeah.
So is that definition correct? And does the patient need to be on a ventilator to perform the test to find out if they're brain dead?
Sure. Let me just quickly examine what is death to begin with, right? And as Christians, we have chapter and verse for this. In James 2:26, it tells us the body without the spirit is dead, right? And of course, even people who aren't Christians, that's generally what people understand death to be, that separation of our immaterial spirit from our material body. But, of course, we don't have any device to detect when an immaterial spirit departs. That exact moment is opaque to us. So for thousands of years, what people have done to be sure that the spirit had departed was wait for the loss of heartbeat, the loss of breathing, and then the passage of time to be sure that the spirit had departed. This gives us our traditions, our wakes, our vigils, our waiting to be sure that our loved one has departed. But now the brain death definition that you showed a moment ago was simply made up out of thin air by 13 men at Harvard Medical School in 1968. And I was just reviewing that landmark article in the Journal of the American Medical Association. The title is A Definition of Irreversible Coma. And interestingly, those doctors never claimed that these people are in fact dead. And the words they used, they said these people are desperately injured, which is not the same as being dead. And they said that would be a good thing for society to take these desperately injured people and redefine them by the stroke of a pen. They had no facts, tests, or studies about this. They thought we could redefine desperately injured people as being dead already, because it would free up beds in ICUs, and it would remove the controversy over using desperately injured people as organ donors. So again, this definition is just that. And again, it's the battle over the dictionary, as we see so much in our culture. Changing a definition does not change the reality. But it was very useful for organ transplantation, because there's something called the dead donor rule, which is not a law, but it's a moral thing that says you shouldn't take organs out of someone who's alive, and you shouldn't kill someone by removing their organs, right?
And
so,
as you talk about this, I want Chris to put up the next pic, because that is the dead donors rule. Yeah. Now you can go ahead and continue talking about it.
Yeah. So again, this idea of brain death was very useful, because if you simply, again, without fact, studies, or evidence, by the stroke of a pen, redefine desperately ill people as being dead already, well, now the dead donor rule is met by sleight of hand, right? And so then the definition of brain death you showed earlier has been put into our laws under the Uniform Determination of Death Act, or the UDDA, and they define it as the irreversible cessation of all functions of the entire brain, including the brain stem. So do you notice the switch we've made? Instead of having death be the departure of the immaterial spirit, now it's the departure of certain neurologic functions. you don't even have to think about whether that person's spirit is within their body or not. And that's what's happened with brain death. We've forgotten about where is that person's eternal soul. The person I
Yeah.
anesthetized, I'm here to tell you, it was still in his body until we
Yeah.
basically dismembered him to death.
Yeah, and I want to get on 2 points, and I want to get on that one and one more on the dead donor rule. And with that clip, I wanted to show the AI thing that I was talking about. And the dead donor rule, it said people must neither be alive when the organs are removed, nor killed in the process of organ removal. But it says that brain death was the basis for organ donation, and that as a standard for organ removal while the heart is still beating. So the dead donor rule is in direct contradiction to brain death right here. I mean, and it's showing it up on a Google search. And thank you, Chris. And so, am I understanding that correctly?
Well, yes, this is why brain dead people make such excellent organ donors. I mean, they have a loss of neurological function, but because their heart is still beating, their organs are well perfused. They have lots of oxygen and nutrition flowing through the body. So the organs are kept in really, really good shape to be transplanted into somebody else.
So, and well, now I have another question before I went to the, but I'm still holding on to that other question. So, can a patient have their heart stop completely? And then, like you said, we want to wait for time. Is there a certain amount of time where we know that it's better if it's beating and they're able to transplant it, but is there a certain amount of time where you wait and you're just like, no, that organ's not going to be viable because we've waited too long?
Okay, so there's other ways to be an organ donor, and brain death was introduced in 1968, but they're always looking for ways to expand the donor pool. So in the early 1990s, another way of becoming an organ donor was initiated called donation after circulatory death. Now, these patients are not brain dead, but they're very ill and they're either not expected to survive, or they're people with degenerative conditions whose life quality isn't what they want, and they want to have their life support removed on that basis. So what they do is they make the patient a do not resuscitate status,
Right.
as you're familiar with from the COVID, right?
Mm-hmm.
And so these are people who could be resuscitated, but a decision has been made not to do so and to remove their care in a way that allows for organ donation. So these people are taken to the operating room and they're removed from any ventilators and all their support, and they're monitored until their pulse stops. And then doctors, depending on where you live, in my home state of Wisconsin, it's 2 minutes. In other states, it's 5 minutes. The doctors give a 2 to 5 minute standoff period to be sure the patient's heart doesn't spontaneously resume beating. And then they
Right.
begin as quickly as possible to begin to remove those organs, because warm organs without blood flow very quickly become unsuitable for donation. They begin to deteriorate.
Yes. And then another question is, what I've seen, I've seen so many stories where near death experiences where people have been clinically dead. And I think I looked up the longest was, I can't remember. It was an hours. It was many hours. And the person was dead and then they came back to life. And I'm like, how is that even possible? But there's been many situations where, several minutes people have died, longer than 2 minutes, and they've come back. And I don't know, in some cases they're working on them. In some cases they haven't worked on them. They've just come back alive. And they talk about their spirit leaving their body, looking at their body, able to tell you everything in the room and what everybody's doing in the room. And then when they get back in their body, their spirit connects back to their body comes back to life, and they're able to tell these people. And of course, the doctors don't believe them. They're like, "Oh no, that was not enough oxygen to the brain," which doesn't make sense, because if you don't have oxygen to the brain, then you're dead. So, and you can't have these thoughts and stuff. So it is a spiritual thing the way I see it. But yeah, so have you had any instances where people have told you about that? And I know that you talk in your or show in your slideshow several people who came back after a certain amount of time that were declared brain dead.
Absolutely. And as far as near-death experiences, these have been documented since the time of ancient Rome and continue to be documented to the present. There's just too many of those stories to just dismiss them. I really do believe that there is a bona fide chance that your spirit could be departed somewhat, but then with a resuscitation taking place, reunited to your material body. And then people tell us these amazing stories. But with brain death, yes, many people have recovered from a diagnosis of brain death. And again, if you think of that definition you put up, didn't you just put up a definition that included the word irreversible? Well, brain death has been proven not to be irreversible. People who have been declared brain dead according to all the protocols, the way it should have been done, have recovered. And so I talk about, for instance, Zach Dunlap, who was a young man in 2007 who had a rollover ATV accident and a terrible head injury. He had brain tissue coming out of his ear canal. Well, he was brought to the hospital and he was declared brain dead according to the protocol, but he was too unstable to have some of the usual brain death tests done. So the protocol says in those instances, you need to do a test such as a brain blood flow study. And so Zach Dunlap had a brain blood flow study, which was read as no flow to the brain. But, the American Academy of Neurology admits in their brain death guideline that all ancillary tests like brain blood flow studies have shortcomings, and none are 100% sensitive and specific for brain death. So according to the protocol, Zach's death was declared based on a brain blood flow test that is known not to be 100% accurate. And this was very nearly the end of Zach's life. The helicopter was landing with the team to take his organs when his cousin, who was a registered nurse from a different facility, came to visit and didn't think that Zach was dead. So he took his closed pocket knife and he scraped Zach's foot, and Zach withdrew his foot. So the cousin called and said, nurse, come over here. Look, my cousin's moving. And the nurse actually said, well, they teach us in brain death school that the patient can be moving, but they're still dead. So then Zach's cousin went and gave a painful stimulus on his nail bed, and Zach pretty much took a swing. And the nurse said, oh, wait, that movement crossed the midline. So that movement counts. And the whole thing was called off. But, Zach later told Dr. Paul Byrne in an interview that while he was supposedly brain dead, he could hear every word. He said he heard the doctors telling his parents that he had passed away and he could become an organ donor. And he said, there was nothing I could do. I couldn't yell. I couldn't scream. I couldn't sign. All I could do was get extremely angry. And then Zach, thankfully, because of his cousin's intervention, not his healthcare team, his recovery was so full that he was able to go on and get married. He has a little girl and he works a job now. So these people are in no way dead, and these survivors show that they're not. And what really concerns me about Zach's story as an anesthesiologist, can you imagine? Some anesthesiologists do not use consciousness blocking drugs, just paralyzing agents. And can you imagine the horror people like this could be going through?
That's what horror movies are made of. I mean, literally. That's a nightmare come to life, to have to go out that way. And that's another thing why I totally believe in allowing family in the hospital. The time during COVID where they were locking family members out, the people that know these patients the best, and then saying, well, the hospitals were overrun, and the dangers. Well, we were already in contact with each other. Let's face it. If we were going to catch anything, we already caught it. We live with each other. They were supposed to die. You can't keep people away from their loved ones like that. And this allowed his cousin to be able to come in because he knew his cousin better than any of the staff there. And so it really should be a combined effort of trying to let a person either die with dignity or trying to save a person with dignity. But dignity has to be included in it in all realms of it. And you can't do that when you isolate them and when you narrow it down to just they're a definition and a commodity on a table. I mean, they're humans with, like you say, with a soul, a spirit, and a body that's combined to make who they are. That's what separates us from animals and jellyfish and everything else. So when you go into your story, you had said they asked you, are you going to use a drug that blocks consciousness? And you said, well, why would I do that? Which is a normal question. And he said, just in case. Let's talk about consciousness a little bit. And I have a definition of consciousness, and I want you to tell me if this is right or not. The quality or state of being aware, especially of something within oneself. So, being aware within yourself. You may not be able to talk or move or whatever, but you are aware. So Webster defines it as having mental facilities not dulled by sleep, faintness, or stupor. But, I'm when I'm sleeping, I think I'm still conscious. I mean, I don't know. Maybe I'm not.
Yeah. Consciousness is a tricky word. It has two parts. Of course, there is the part about being awake, and then there's a part about being perceiving, right? So it combines both of those things, being awake and being able to perceive. But find out, doctors are not that good at being able to tell if you are able to perceive. I mean, they can see your eyes are closed, and they can see if you are able and willing to respond, but they have no way, they have no instrument to tell if you are inwardly perceiving things. And there's even a fancy doctor word for that. It's called cognitive motor dissociation for people like Zach Dunlap, who was inwardly aware and perceiving, but unable to respond. And that's part of the problem with the brain death protocol. Doctors test for responsiveness, but they have no way of knowing if you're actually inwardly aware.
Yeah. And, this kind of reminds me of one instance where we were working with a guy in a hospital, and, this guy had never taken pain medication, and his wife didn't want him on any medication. He was ventilated, but they had him at a pain scale of 0, and they were giving him fentanyl every 30 minutes. And she was unaware of this. And she said, well, why are you giving him that? And, that's it. I think that is the most strong drug that the hospital can give. And why would you jump from fentanyl to, go through everything else, the drug that's 150, 200 times stronger than morphine? Why wouldn't you start off kind of slow and work your way up? That's my thought on it. And the doctor says, well, we go by the grimace scale. And I'm like, what is the grimace scale? And they said, well, if he makes a face or something, then it's up to the nurse to decide if he's in pain or not. And I'm like, what? I was like, I grimace in my sleep and nobody comes and injects me with fentanyl, Some of these arbitrary tests or observations are just like, where do they get them from? And now I can see there's a lot of mental gymnastics going on here and verbiage to really get an agenda driven. And that just, I don't know about that. But I wanted to play this clip about consciousness, and I think I got it from your ex post. And y'all need to go follow Dr. Heidi on there, because she has great posts all the time about stuff like this. And Chris, go ahead and play clip 1 for us.
Did you know that organ donors can actually feel their organs being removed while they're supposedly brain dead? Medical teams have documented that 17% of brain-dead patients show measurable brain activity during organ extraction procedures. Some donors have been observed opening their eyes, moving their limbs, or showing dramatically elevated heart rates as surgeons begin cutting. But here's the disturbing part. Donors are given paralytic drugs specifically to prevent movement during the procedure. This means they could be fully conscious, but completely unable to move or scream. Medical teams are actually instructed to ignore these signs of awareness and continue with the harvesting. Recent cases have documented donors attempting to breathe on their own and showing clear pain responses when organs are removed. The families are never told when their loved ones show signs of consciousness during the procedure. This practice is considered completely normal in the medical industry because the donors are legally declared dead, even when they're clearly still aware of what's happening to them.
Yeah, that just should not happen. And do you have any remarks on that?
Oh, sure. That clip was actually sent to me by I have a colleague in the Netherlands named Annette Wood, and I had to tell her, I have to correct you. It's not 17% of brain dead patients have electrical activity on EEG. It's more like 20%. And again, it does go against the legal definition of being brain dead, because you're supposed to have cessation of function. And if you've got brain waves in 1 in 5 people, that clearly shows that brain function has not ceased. And the video clip brought up that people had been found to be breathing and showing signs of life while their organs are removed. If you'd like, I can tell you the story that was recently reported in the New York Times about Misty Hawkins.
Yes.
Okay. So Misty Hawkins was an unfortunate young woman with a cognitive disability who choked while eating lunch and had a low oxygen brain damage problem, was found not to be brain dead, but doctors told her parents that Misty probably was not going to wake up, and offered them the opportunity to remove Misty's care in such a way that she could become one of these donation after circulatory death, or DCD, organ donors. And, Misty's parents didn't want her to suffer, and they thought they could use their tragedy to help someone else. So they gave their consent. Again, not fully informed, but a well-meaning consent. So Misty was taken to the operating room, and she was removed from her ventilator and her support. And it took her 103 minutes for her heart to stop. Once that happened, then the doctors in her state waited 5 minutes and then immediately began operating. But when the surgeons sawed through her breastbone, they found that her heart had started beating again and she had resumed breathing. So at that point, the surgical team walked off and they found another doctor to stitch her up. It took her another 12 minutes of I can't imagine what kind of agony to die again. It's not clear if she received any anesthesia. But even more disturbing is that, as was mentioned in the video, her parents were never told. And an organ procurement organization coordinator called Misty's mother and said, "Gee, we're sorry. It just didn't work out for Misty to donate her organs." And it wasn't until a year later, when the New York Times contacted Misty's parents for comment, that they learned the truth about what had happened to their daughter. As a mother, I can't imagine knowing that it happened to my child.
Oh my gosh. I that is horrible. At first I thought you were going to say when they stopped and they saw that her heart was beating and they went and got another team, I thought you were going to say, they stitched her back up and they allowed her to come, back and to life. But once you cross a certain point, is the liability too much on the doctor and the worry about, coming clean to the family because they were afraid of being sued for malpractice? Is that what drove them to say, okay, we've already committed, we're going all the way with this?
Yeah. Well, again, to be a DCD organ donor, you have to have a do not resuscitate order. So the doctor's hands, in
Oh,
a sense, were tied. They could not resuscitate her. They had to honor what the family had chosen, no resuscitation. But this conspiracy of silence as to what goes on in the OR stays in the OR has to stop. I mean, I'm so glad that cases like this are coming to light, because we need full transparency about what's been going on. My friend Dr. Ari Jaffe has done a literature review and has found that people have spontaneously resuscitated themselves, auto resuscitated without any medical intervention at all, up to 10 minutes after cardiac arrest with full recovery. So from the medical literature, we know that up to 10 minutes, you could still be resuscitated, even auto resuscitate yourself. And so you are not dead. So it's absolutely criminal to be waiting just 2 to 5 minutes when medically we know that you are
yeah.
still really alive at that point. So this idea of DCD organ donation after a mere 2 to 5 minutes has to stop.
Yeah, I totally agree with that.
Mhm.
Wow, that story is something.
Mhm.
And you were talking about the laws, and then I got this from your ex post, or maybe it was your website. By the way, y'all have an excellent website. It's respectforlife
No,
dot com.
be sure to put the word human in there. You won't find us.
Yeah,
Respectforhumanlife.com.
we got it on the screen there for
Mhm.
you. And respectforhumanlife.com. And on that site, you also have a slideshow that goes through all of this and some stuff that we probably won't be able to get to, just because there's so much information there. I'd love to have you back on sometime and we can go through the rest of it, because you're a wealth of knowledge. But you'd said that the new American Academy of Neurology brain death guideline now explicitly states that brain death can be declared in the presence of ongoing brain function. It has long been known that 20% of people declared brain dead still have electrical activity on an EEG, and over 50% have ongoing function of a part of the brain called the hypothalamus. But the Uniform Determination of Death Act, okay, this is an act, and it stipulates that there be an irreversible cessation of all function, not a little function here and there, but all function of the entire brain for a legal diagnosis of death. So, with that being said, this organization, the New American Academy of Neurology, what authority do they have to override a law with a guideline that they created?
Very good point, Greta. They do not, and in fact, there have been so many lawsuits pointing this out. In the case of Aiden Halou, the Nevada Supreme Court ruled unanimously that the American Academy of Neurology brain death guideline did not meet the letter of the law under the UDDA. So the American Academy of Neurology petitioned the Uniform Law Commission, asking them to revise, to change U.S. brain death laws. And the Uniform Law Commission met for about a 3-year period. They could come to no consensus whatsoever about doing this. When I was an observer to the Uniform Law Commission, and they brought this proposal before their membership, and the lawyers were just like, why are you asking us to change the law to accommodate doctors who are breaking it? Why don't we just ask the doctors to follow the law, right? So it went
There you
nowhere.
go.
It went nowhere. So now what the American Academy of Neurology is doing is they're trying to lobby individual state health boards and asking the state health boards, without any legal process, just by the stroke of a pen, without any democratic input whatsoever of the populace. Let's just say, from the health board standpoint, that the American Academy of Neurology brain death guideline is what we use in our state, and trying to bypass the law that way.
Okay, so people need to be in each of your state. You need to be looking out for that. You
Mhm.
need to see if there's an organization out there that's saying, "Look, these are the guidelines we follow." Or are they following a guideline, or are they following the law? And this law that is the Uniform Determination of Death Act. Is that law in every state?
In almost every state. After the Aiden Halou case in Nevada, where the Supreme Court said that the UDDA was not being followed, legislators who were being lobbied by organ procurement organizations actually changed Nevada law. So now in Nevada, the law states that you must be declared brain dead according to the American Academy of Neurology Brain Death Guideline or their successor organizations in perpetuity. So now a private medical organization, and not the people of the state of Nevada, say who's dead or alive in that state. New York's health department has adopted the American Academy of Neurology's Brain Death Guideline just at the stroke of a pen. And so in New York also, they will use that guideline. Though in general, it is used in most states.
Wow. Okay, so yeah, well, but we need to really be aware of this, and this is why I tell people you need to start asking questions, because we can't give a blanket answer and say this applies to everyone. You need to be on, understanding what's happening in your community at the city level, the county level, the state level, and then also your federal level. And I hate to say that, but instead of seeking entertainment, we need to be seeking knowledge. I mean, for me, I think, and people might say, well, you're a nerd. Well, hey, I'm a nerd that's alive, So how much do you value your health in your life? Do you want the quality of your life to be sitting on a couch watching a TV for a very short time? Or do you want the quality of your life to be healthy, out and about, and enjoying the things that God gave us? And the only way we can do that is if we keep ourselves informed about the things going on around us. So that was something amazing to me, that a organization was overriding the law, and the things like consciousness and things like that. This terminology is ridiculous. So we really need to have discussions like this and get knowledge from people like yourself, and be aware of everything around you. I want to move on to what I noticed looking at medical records of COVID patients, that once a patient was vented, it seemed that organ referral was the main priority. And I want to show a hospital's criteria for organ referral, from one of the patients that I had looked at. Unfortunately, her mom was killed in a hospital. Chris, can you go ahead and put up pick 3 for me? Okay, and I don't know if you can see that, but from what I understand, the GCS scale is the way of measuring consciousness, which who knows about that. And the second criteria was loss of one or more brainstem reflexes. And you have to understand that they're all on so many different medications at this time as they're being ventilated, and they haven't been taken off these medications. And the patient's physician must initiate a poor prognosis discussion. And they were told several times, your mom's going to die. Your mom's not going to make it. And this lady only had one kidney. And, your mom's going to die. Your mom's going to constantly. They were all told that even before they got ventilated. And then number 4 was is being considered or evaluated for withdrawal of ventilator support. This applies to all ventilated patients, regardless of neurological function. So even if their neurological function was fine, they were going to be referred for organ referral. And they called on all patients, regardless of age, diagnosis, and or condition. These patients are potential donors. So what are your comments on this criteria for organ referral?
Well, in fact, hospitals are required, in order to receive Medicare and Medicaid funding, to refer anybody who might become an organ donor to the organ procurement organization. It doesn't matter if you're ready now. The policy is, if you think they might become an organ donor, you have to do this. And if you don't, you could be challenged by the organ procurement organization and possibly lose federal funding for that institution.
Yeah, they're definitely in bed together, because the number one payer of organ harvesting, procurement, and transplant is Medicare. So of course, it just boggles my mind. And the only thing that I can think of is why is Medicare so willing to pay out and force this on patients and patients' families? I'm thinking this has to be some sort of a medical mafia, some sort of a cartel where they funnel money through the hospitals or something, because this is not morally or ethically something that should be done. I mean, it's not. I've said the most dangerous thing to a patient is excellent health care insurance and Medicare and Medicaid. That's what it turns out to be. I just can't believe that. Yeah. So that's one of they have to do it.
That's correct. And again, I never want to impugn anybody. I really think that a lot of people who work in the transplant industry are altruistic people. They've been given the same misinformation, false, incorrect information that the rest of us have, and they really believe they're doing good. At the same time, the Milliman Actuarial Company this year for 2025 came out with, what type of billable charges are going out there for organ transplant, and overall, it's an over $60 billion industry. I mean, the body you give away for free is worth upwards of $5 million in billable charges.
Yeah, and you notice that the donors never get offered, well, let's pay for your funeral, or let's give you some money for a wake, or let's not charge you hospital bills that you acquired to die here. And because we're going to be making a crap load of money off of your loved one's organs, so you don't have to worry about the hospital bills. They don't do that. I mean, like you said, they're making money off of your donations. It's just, to me, it's a business. That's what they see it as. And as you said, the individual person, they get into this. I hope nearly all of them get into this for the reason that I want to help people. When I see, my daughter's friend, she's like, I want to be a nurse because I want to help people. And I think, that's such a good reason to want to do something. And I think that a lot of these people, that's what they want. And they think that they're helping people. And then some of them get in it and then they realize, well, I want to do this to help people, but this does not feel right. And then they end up questioning things and pulling out. But then there's others that's like, no, this is just the way it is. And I am helping people. So yeah, we can't condemn the individual person, but we can condemn the system, because this is not right. I mean, this is just what's going on. Like you said, waiting 2 minutes, that has to stop. That has to change. We have to acknowledge that these are human beings and that you are making money off of them, whether they want to admit it or not. You're making money off of a human being.
Yeah,
and that has,
for me to talk about it because I'm retired. They're no one threaten my job because come and take my job and do my dishes, please, right? But honestly, I know people who are still in the healthcare industry, and they are afraid that if they question it, they'll lose their job. So most of them make lateral moves. I mean, ICU nurses move to the clinic side so they don't have to work with these situations. I have a friend who's an anesthesiologist, and she came to the realization that these donors are not dead and knew she couldn't take night call where that might be a possibility where she'd have to be responsible for that. So she made a lateral move and now works at a women's hospital doing labor epidurals, right? So people just, I actually this summer, I met my first transplant surgeon who had changed jobs. I mean, he said, I saw this man wiggling his toes and everyone was going along with taking his organs. And he said, I knew that wasn't right. So now he practices general surgery. I mean, people just make a lateral move, but it's time to just speak the truth in love to one another about these facts so we can make things right. I mean, goodness, we care about people with organ failure. We want to provide them with good ethical ways to maintain their health. But, so many people with organ failure too. I mean, their consciences are being violated. I know a man who, he needed an organ and he received it, and then he found out later that the person that it had been taken from was dead at the time was not dead at the time it was removed, and it went against his conscience. And so that's why I always want to bring in the human element. I tell people, if you're a doctor or a nurse and you were just, you have to learn so much information that there's no way possible that you can investigate personally everything that you're taught. So you have to take a lot on authority. Your authorities told you this is the way it is, and then that's what you believe. So you were, in a way, you were caught up in something that now that you look at the information, something that you can question. And also I tell people, if you gave a beloved family member out of the goodness of your heart to be an organ donor, it is not your fault that you were not given this information. And the person who received the organ too. I mean, you made the best decision you could with the information you had available at the time. It's not your fault. But as we are caring for one another, part of caring for people is to be truthful, and knowledge is power.
Right.
That's how we fix this system.
Yes, exactly. And when you know better, you do better. And that's what we're trying to, I think God gave you that experience, and God gave me my experience, so that way, we can take what we know and share it, because we're willing to, and we're willing to be obedient to that. And I think that like this hospital is, a Methodist, and so they're supposed to have a very spiritual presence with the church. As a matter of fact, the church board has a heavy hand in everything that they do within the hospital, and they talk about respecting people's religious beliefs and all types of religious beliefs and understanding. Why don't they respect the religious beliefs of their staff? Like if someone comes up and says, "Look, yeah, I'm an anesthesiologist, but I cannot use drugs on a patient when it comes to brain death diagnosis, because for me, in a spiritual way, I feel that is not true. I feel that the spirit is still within the body, and that is my belief. That's my deeply held spiritual and religious belief. And in that case, I feel like I should withdraw myself from these types of situations. I can still be an anesthesiologist wherever, but when it comes to brain death, or when it comes to organ harvesting or whatever, based on my spiritual and religious beliefs, I would like to be, taken away, exempt from doing that. Why can't there be something in place like that for doctors and nurses?
Well, in fact, there is one state, New Jersey, believe it or not, does have a religious exemption to brain death. And they've had it for over 20 years. And, New Jersey is in no worse financial state than the rest of our states. So I think, why not have a nationwide exemption to a brain death diagnosis, and not just a religious exemption? People should be able to opt out for any reason.
Yes.
Right? We should all, if it goes against our conscience as a patient, as a doctor, as a nurse, we should all be able to opt out of this, because really it's built on such a shaky foundation. There are no facts, there are no tests, there are no studies. In fact, the most recent American Academy of Neurology brain death guideline, if you look at their methods section, they come right out and say, because of the lack of high quality evidence on the subject, this guideline was determined by the consensus of a panel of experts. And if you look, well, who are these experts? They come right out and say that they excluded experts who might not agree. And the supposed experts came up with this guideline not on the basis of the scientific method, but by 3 rounds of anonymous voting. This is a terrible foundation to decide life or death. And so I think nationwide, what we need is an opt-out to brain death for everybody for any reason.
Yeah. And for every patient, and as well as the staff, if they don't want to, if they don't feel comfortable doing that as well. I want to go ahead and play clip 2. I liked clip 2 because I liked Dr. Verone. He's a close friend with Dr. Bowden, and he was one of the few that was giving the ivermectin in the hospital. And I remember thinking, if I ever get really sick, I'm going to go see Dr. Verone, because he is actually stepping up. And I saw him on the local news, and as soon as he started talking about how many patients he was healing with ivermectin, they shut him down completely. They actually tried to shut down his hospital. And then I remember, I haven't heard of him anymore. And then my case got so severe so quick that I had to go to the nearest hospital. And I wasn't able to get to him. But when I saw this clip, I thought, yeah, he's going to tell the truth, because, I trust that he will. So go ahead and play clip 2.
Many people, instead of thinking, how are we going to try to save this person? The first thing that you are told is, start calling the transplant team ahead of time. So the person is not even dead, and you're already calling the transplant team.
HHS Secretary Robert F. Kennedy Jr. recently said that the agency has found a disturbing disregard for the sanctity of life in organ procurement systems in America. In this episode, I sit down with critical care physician Dr. Joseph Varon, co-founder of the Independent Medical Alliance, to learn more about what he's seen firsthand.
There were more than one instance where I would go in, I put in my little scope, and the patient starts either moving or coughing. You look at the nursing staff and you say, hey, this person is not dead. What are you talking about?
This is American Thought Leaders, and I'm Yanya Kellick.
So he's speaking the truth, I do believe.
Absolutely. They just interviewed each other again last night on X, and it was wonderful. It was very refreshing to hear the facts come out so clearly between those two gentlemen.
Mm-hmm. And that's what I want to say, that this information is out there. We just have to be willing to dig a little bit and look for it, because they will try to censor us. I know all about it. I remember looking on your X space and seeing you had like 4,000 followers. And I'm like, how does this woman only have 4,000 followers? This just blows my mind. And then I'm thinking, Greta, same thing's happening to you. They're not going to let it get out. So, but yeah, you just have to look a little bit. Before we go on, I want to take another quick break. I wanted to let you all know that this platform is free for me to be able to do this, but that's only because of the Street Talk Network. They're amazing people, and they allow me to do this at no cost, but it costs them still, because they have to pay for the platform and pay for all the software and pay for everything. So they do depend on donations, and what's not donated comes out of pocket. And if you can all go to streettalk.com or streettalknow.com, don't forget the now, streettalknow.com, and donate or find some merchandise. You can also go to lightdovministries.com and promote the code Street Talk to get a 15% discount. We appreciate all they do to help people with natural healing. And you can also go to protocolkills.com to get free documents to protect yourself in case you have to go to the hospital. At least you'll have your rights all lined out on what you consent and what you don't consent to. And thank you all again for helping us out. And we will be right back after this quick break.
Send me an angel, won't you send me a sign? Send me a message, watch it fall from the sky. Well, spirit surrounds me, I'm feeling fine. Let's come together now. Hey, Jesus, my Lord, everybody's fighting about God. Hail Mary, Holy Spirit, I need you, can you hear it? Hey, Jesus, my Lord, they're all fighting, my God. If I respect the way they pray, then they respect the way I pray.
All right, welcome back. And we have Dr. Heidi Klessig, author of Brain Death Fallacy. And I'm getting so involved here that I may not even get through all my notes. But I want to talk about the testing for the brain death because I was looking through it and I was looking at different tests that they go through. And of course, The more I looked, the more confused I got. And can you tell us about the testing that needs to be done, and kind of go through the steps? Like the patient is ventilated and they're coming to you and saying, okay, your loved one is, we're going to test to see if they're brain dead. What are the steps of the process that they go through?
Sure. So the person has to have a very severe injury. First, that's the first step. They're neurologically injured. They're needing a ventilator to breathe for them, to push the air in. Of course, their own body is still absorbing the oxygen and metabolizing and releasing carbon dioxide. They are fully alive that way, but they're not able to initiate their own breathing. And they have to have a diagnosis that would be something that looks fairly grim, right? So then when you go into diagnosing brain death, the patient has to have no drugs of any kind in their system, though honestly, sometimes that slips through the cracks. But the protocol says they should not have any drugs in their system. They should have fairly normal blood pressure and heart rate. It's sort of interesting that they want you to have a normal blood pressure and heart rate to be able to pronounce you dead, but that's the fact. You should have.
I'm sorry to laugh, but that is just crazy to me.
The cognitive dissonance is stunning. You have to have a normal blood sodium and calcium levels. Your labs should look pretty good for you to be dead. And one thing, it is pretty Orwellian as we talk about it. And then the guideline emphasizes that brain death is primarily something you diagnose at the bedside, and that these extra tests, things like EEG for brain waves, things like brain blood flow studies, really, they don't need to be done. They should only be done if there's some question of doubt, or if you can't, like Zach Dunlap, he was too hemodynamically unstable to be declared dead, so they did a brain blood flow scan in him. But in general, those extra studies are not required for a brain death diagnosis. And so again, as you showed earlier on the slide, the law says you have to have the irreversible cessation of all functions of the entire brain, including the brain stem. In point of fact, doctors do not check for all functions of the entire brain. They check for basically, four things. The first, are you able to respond to a painful stimulus? And we mentioned earlier that, being able to respond is not the same thing as being inwardly aware. And Zach Dunlap was our example of that. He was inwardly aware, but saying he couldn't respond, and it made him so angry that he couldn't scream or move or let people know he was in there, right? The second thing they test is that you don't move to a painful stimulus. But again, as we talked about with Zach Dunlap, certain movements count and others don't, right? Zach's cousin got him to withdraw his foot, but the nurse said that didn't count. That movement dead people apparently can do. But when Zach did a movement that crossed the midline, that one counted. The one that really bothers me is they have one where the patient seems to be reaching up to grab the endotracheal tube, and they say that's just a reflex too, which that just blows me away.
It's a reflex. I want to get this out of me because I want to breathe on my own.
And the guideline actually acknowledges that this is challenging, which movements count and which don't. And I'll give you a quote right from the guideline. It says, "It can sometimes be challenging to determine whether a movement is cerebrally or spinally mediated based solely on clinical exam." So they tell you if you're not sure if your moving patient is dead or not, you should ask a friend. They actually tell you find a colleague and see what he thinks, right? Then as far as the neurologic exam, it's not all functions of the entire brain. For adults, they see if your pupils react to light. They see if your eyes get dizzy when they turn your head or shoot cold water in your ear canals. They don't test more than a handful. They don't even test all the brainstem reflexes, just a few of them. And then the last is called the apnea test. And in the apnea, it's not like sleep apnea. Apnea test, they draw you from your ventilator and wait to see if you breathe on your own without the ventilator's help, right? The apnea test is a dangerous test. I was just reviewing the AAN guideline today, and they admit, this test can cause low blood pressure, low heart rate, arrhythmias, pneumothorax, possible cardiac arrest. But they also say that you don't need to ask the family for any type of informed consent to do the apnea test, despite the fact you don't yet know that the patient's dead and you're submitting them to significant risk. And moreover, the guideline admits that, the parameters for this test, the word they use is arbitrary. This test has arbitrary parameters because we don't have any scientific data to know exactly how high your carbon dioxide level would go before you would start breathing in your brain death.
Right. You have
So
no baseline to go by for each individual because we're all different.
That's right. Absolutely right. So again, it's not based on science. It doesn't follow the law. You're not biologically dead. You've been redefined as being dead enough to become an organ donor.
Right. Right. There's a level of deadness to you that we can say you're expendable at this point. We don't really see your quality of life meeting our standards, so you're dead.
And
I mean, that's
what's
just
really sad is that, even if you're not an organ donor, doctors are going to withdraw your care if you fail these brain death exams. And my friend, I have a friend, Bishop Anthony Allen, his son, Terrence Howard, was hurt in a car accident, and they just wanted care for their son. They wanted to transfer him to another hospital, but they said the doctors were out in the hall snickering and laughing as the family pleaded for ongoing care and not to have care removed from their son. Unfortunately, over their objections, care was removed, and Terrence passed away.
And that reminds me of the case that was, I believe it was in the Houston area, not too far from me, where the man had claimed he had a gun, and because he knew that his son was alive. Again, these family members know, and held off the team from unplugging his son for I forget how long, and his son recovered, and he had to go before the judge, and he got charged with bringing he didn't even have a gun. He just lied and said he had a gun, but he still got charges brought against him criminally for what he did. But in the end, it saved his son's life, and as a parent I would do the same thing. So it's really insane to do this, especially when you have family members out there who are willing to do anything to save their child. It's not right, and it's causing so much chaos within the system. And I think that was actually on one of your slides, is the case I was talking about.
Yeah, that's George Pickering III was saved from a brain death diagnosis because his father, George Pickering II, held off the medical team, and during the standoff, his son began to respond. It's a beautiful story, but he did spend jail time for it, but it was for all the right reasons. The other thing people often don't realize is that a consent to donate, even if you signed up at the DMV with no type of informed consent, it is considered legally binding. Your family or healthcare surrogates cannot overrule that. And this has been a tragedy in so many cases. There's a young man named Elijah Smith in Ohio. He was riding a bike home from work and got hit by a car, declared brain dead. His family said, he changed his mind. He didn't want to do this. We don't want him to be an organ donor. The organ procurement organization sued in court and won the right to take his organs over the objections of his family. I mean, his family was absolutely devastated, but there was nothing they could do. So again, people aren't informed how legally binding this snap decision to be an organ donor is.
And this is why I advocate for the documents. The documents that we have on protocolkills.com, there is a section there where you can check to say, I refuse to be an organ donor. And it even says I refuse an apnea test for donating the donation of organs. And through that, it's a notarized document. Oh, it's upside down. Is it upside down? No, you have it. No. You had it right. I'm sorry. I can't see it on the
So
glass.
I have on my website, you can go get one of these. I have a
right.
link. If you go down halfway down the website or a little beyond, it'll say, how do I get off the donor list? And we actually link to our sister organization, the Healthcare Advocacy and Leadership Organization, or Halo Voice. And they have a downloadable card that you can do right off your
Good.
printer. Or if you call them, they can send you the pretty laminated one, and you can fill that out and keep it in your wallet. And that also is important. People think that if you're not a registered organ donor, well, then you're in the clear, right? Not
No.
so fast. You're not. The 2006 revision of the Uniform Anatomical Gift Act now says that if you come into a hospital and you're incapacitated, you can't make your wishes known, and your family cannot be found in a timely manner, even the hospital administrator, unless you have documented a specific refusal, right? I refuse to donate. If you don't have that documented, the hospital administrator is authorized to make you an organ donor on your behalf. And this is a case going on right now in New York. An elderly grandmother with a little bit of a cognitive memory problem wandered away from home and sadly was struck by a subway train. And her name was Miriam Hoyos de Baldrich. She was brought to a New York hospital as a Jane Doe, even though the family says there was information in her pocket that would have led to her identity. And they had filled out a cognitively vulnerable missing adult report with the police. But the New York hospital, they didn't know Miriam's wishes. They didn't find a specific refusal to donate. They couldn't find the family in a timely manner, whatever that means. And
Right.
so the hospital made her an organ donor and took her organs while her family was searching for her. I mean, I hope they win their case, but according to the revised Uniform Anatomical Gift Act, they may not. And so that's why I tell people we really need not only not to register, we need to document a refusal if you don't want
Right.
to have this happen to you.
Document a refusal and bring those documents of current care. That's the difference in the documents that we have. It's not as they would say the like a medical power of attorney, or in case I lose consciousness. These are current cares. This is the care that I want right now. And because what we learned with COVID is you could tell them, no, I don't want remdesivir, or no, I don't want to be vaxxed, and they would give it to you anyways. And because they knew that that patient was going to die, and the dead patient can't argue with anybody, and you can't be sued. And so they would tell them, we never got those documents. We never saw those documents. And they're like, no, we gave you these documents. No, we didn't. So what we ended up doing is, getting documents that are notarized, and that we would hand them, you hand them to the doctor when they go in. And if the doctor's like, no, I'm not taking those, then you say, well, that's okay. We've already sent a certified courier service to the CEO of the hospital who's getting these documents. So your boss will have these documents before you get them. And because he doesn't want to be held liable for the work that you do, because you're an independent doctor from the hospital, he's going to make sure they enter the medical records, because if he doesn't, then he would be liable. And in that case, they get entered into the medical records. And we were successful several times doing that. And that shows the current care and what you're refusing, the vax, remdesivir, things like that. And so it's amazing the links that patients had to go to, and still do this to this day. If you're tested positive for COVID, that you have to go for people trying to fight you for your medical wishes to be adhered to. And but this system seems to be working. We hope that people don't have to use it, that they can go to their general practitioner and have it put in their medical records in case something happens, in case I get sent to the hospital, those documents go with me. And that's what I encourage people to do. But if you have an emergency, then that's another way to do it. Just make sure they're sent courier service or certified mail with a receipt, so we know that the hospital got it, and to the CEO. And that's, an insider let us know what was going on there. And that's how we were able to know how the system works. But
I think we've developed something really wonderful and necessary. I'm so glad you're doing that. My daughter was in the hospital recently, and she just told the nurse, look, while I'm here, I want you to put in my electronic medical record that I am not an organ donor. And the nurse said,
Yes.
what? I've never done that before, but I guess I could put it in. And my daughter says, yes, please. And so you can just ask your provider too when you're there about the organ donation piece. But yeah, go along with what Greta's telling you for the remainder of your care.
Yeah. And you will find people that are willing to do it, and then you'll find people that aren't.
Mhm.
And it's like, it just depends on where you go. But my question is, what do you do in this situation? Well, in the case where you have, you've removed yourself from the organ donors list, and you go in, and like with my daughter, I didn't sign the electric form. And in those general consent form papers, it said that you were going to be an organ donor. And unless you read those general consent forms, which nobody can because they don't print them out for you, you just get a keypad to sign. You're signing your organs over, and you're not even knowing it. And it's in there. Which one overrides what? Does the hospital's general consent form override the form that are the being removed from the organ donation list? You're in a battle there. What supersedes what?
Mm-hmm. Yeah, there's a new form too called a POLST, POLST. I think it stands for a physician order for life-sustaining treatment. And again, this goes through, all these end-of-life decisions, and it does overrule your, signed, witness, notarized healthcare power of attorney. So you don't sign one of those forms when they give you that sheath of forms. Just say, thank you. I'd like them printed out. When I've done going over them, I'll let you know. Don't let them stand over you and expect they're going to get them back in 5 seconds.
Exactly. Print it out for me. And then they're like, well, they told me that they won't treat me, and they won't print them out, that I have to sign here, and that they won't treat me. I said, well, that's a contract. And if you are being forced to sign a contract or no treatment, that's called coercion. Mm-hmm. And that in itself is against the law and makes the contract void. And I said, if you're at the door and they're trying to tell you that, you're at the wrong hospital. Go ahead and go to another hospital. And if you're unconscious and, bleeding out and things like that, well, you have no control over that. But if you're able to walk into a hospital and they're going to fight you at the doorstep and say, no, you're going to sign these documents or else, then take or else. Go somewhere else. Mm-hmm. And that's my best advice in those situations. But yeah, I don't know if it helps any, but my notarized documents also say that these documents supersede any hospital's general consent form.
Oh, that's very good.
So, they can take that to court because that's what it says, So we've tried to see every angle that they were going to try to get to a patient and stop them and reverse it. We are fighting a spiritual battle here. We're not fighting with swords and things like that. It's going to take intellect, and it's going to take God's guidance. And so that's what we're trying to do here. Wow. We've gone through so much that I think that I don't want to keep you on too long, but there's even more that I wanted to discuss. And yeah, I had that clip of the organs, and it showed, the form with my daughter and everything. I think I'll go ahead and show that since we were just talking about it, because I think it's very important. So Chris, let's go to clip 4 real quick.
Yes, after your father died, your sister got a letter in the mail thanking her. Can you go ahead and tell us that story?
She received a thank you letter from the Organ Donor Association, thanking my sister for my father's eyes.
Yeah, his corneas, right? Yeah. And what did she say in response to that?
She contacted them. They never got back to her. She contacted the funeral director. He never got back to her. It's like the funeral director was the last person to see him.
He would know.
He would know.
Right. And so you just get this random thank you note for organs, And there's no explanation about it, even though your dad wasn't a donor, right?
No, he was not.
When I sign this general consent form, it's saying that it's up to the doctor's discretion to harvest any organs if he saw they were viable. And I'm like, whoa, wait a minute. So if things go south and the doctor says, oh, she's got good organs, we're going to use them, then I've already signed off on it with the general consent. Here's the general consent. Sign here on the electric dotted line. No, print it out for me. I want to read it. Do you know what you're signing? And these are things that you do not have to agree to these in order to be treated. You need
and
to.
We don't know. Like you said, we don't read this stuff. We got to start reading this shit.
When you sign it, you're agreeing to this. On release of info, it says, I agree and understand that the facility may release my healthcare information for payment purposes. And so people would say, yeah, this is about payment and move on. If you look further down, it says, I also authorize the release of medical information to organ transplant services.
Hell no.
Should I be identified as a potential organ donor? So the doctor will identify you as a organ donor.
Listen, I came in with my organs. I'm going out with my organs. Okay, what happened to my body, my choice?
That's our Street Talk founder there, in case you hadn't.
And that was straight talk. Absolutely.
Yeah, from Boston herself. And you see where I get the inspiration for Medical Mafia. Mm-hmm. But yeah, I mean, that was right there in front of me. And the thing is, they didn't offer to print up a copy of it or anything like that. So I'm in there taking pictures. And at the time, the old me would have been like, why, Lord, are you putting me through this again? But I had matured enough in, my spirituality that I was sitting there with my daughter. I was very concerned about her. Don't get me wrong, but I was still in, and we had prayed over her. I mean, completely. That's while she was having a seizure. That's all we were doing is praying, and she's on the floor. And when we finally get her to the hospital, I was just completely in a zone of, you're putting me in this situation for a reason, and I need to do whatever it is that you have me do. And so I was reading all those documents, scratching out no, putting my initial, and then signing at the bottom, you will not give patient's name without consent. And I need an itemized billing of everything that patient is getting. So that way I knew exactly what she was going to receive. And then I took my phone, I started taking pictures, and I didn't even know why I was taking pictures, because I mean, I guess I could have asked them to print it, even though they didn't offer, but something just told me that you're not going to get them back, And so I took pictures, and then I was able to put it on the show, and I've showed it to as many people as I can, because people really can't believe that that's on there. And so we have to be aware of what's going on. They're very sneaky.
We were talking about before the show, it's not just when you go to the hospital. In my state of Wisconsin, I've heard it's also this way in Texas. They've added consent to be an organ donor to our hunting and fishing licenses. So I have a friend, her elderly husband wanted to go fishing, and he got his permit, and he signed it just like he was used to doing it for the last 50 years. And then they looked down, and what he had signed was consent to become an organ donor on his fishing license. And he was horrified, and they had to go to a lot of time and trouble to make that right. I mean, so you have to look at everything you sign, even if you just want to go hunting and fishing. They may have snuck something in there.
Yeah, exactly. I mean, we have so many governmental agencies that are working hand in hand and slipping in things left and right for, like I said, it's the medical mafia. They're I shook you down, you shook me down. It's going around. So we just have to be aware of anything that you put your name on. Anytime you put your signature to something, you have to know and ask yourself, what am I signing? And when you're sure of it, and if that's a decision you make, then fine. But I'm to the point where I don't even want to sign my T-Mobile agreement unless I read it. And I may not understand half of it, but I'm still going to try to read it anyways. But I want to just thank you again for being on here. And I have one last question because I know I've kept you a long time, but this has been great. And I still didn't get through half the questions I had. So we're going to have you on again. But the last question I have, and I think it's one of the most important ones, is there a way to correct this type of behavior of reversing the blatant and brutal ending of life, and dismantling us like car parts, and making the human body, more of a commodity than, like what you said, a spiritual vessel, which is what it really is. Is there a way to turn this ship around and correct it? Or is this something we're just going to have to fight continuously?
Well, I'm very encouraged that Health and Human Services Secretary Robert F. Kennedy Jr. is evaluating the transplant industry. And they had a press release in July in which he said, our findings show that hospitals allowed the organ procurement process to begin when patients showed signs of life. And this is horrifying. So HHS is looking into it. The U.S. House of Representatives Energy and Commerce Committee has a subcommittee that is also investigating this. I was able to go to Washington, D.C. and give a presentation to staff on that committee, showing them the problems in the system. And I tried to boil down for them, 3 very simple action points. Number one, we need full transparency. Mm-hmm. So that people are able to give informed consent. I showed them that the organdonor.gov website put out by HRSA, the glossary definitions of brain death and donation after circulatory death are both incorrect. I mean, if our government is putting out incorrect information, this is right. Allowing people to give informed consent. Number 2, as I mentioned earlier, we need a nationwide opt-out to the brain death diagnosis for any reason, not just a religious exemption, any reason. Mm-hmm. Be able to opt out if this violates their conscience. And third, for donation after circulatory death, we have to stop this 2 to 5 minute standoff period. It has to be at least 10 minutes or more. We need to actually do the research to find out how long does it need to be, because we know people at 10 minutes have self-resuscitated and made full recoveries. So these people up to that period of time are not dead. And if we continue to take their organs at 2 to 5 minutes, we are guaranteed to have more people like Misty Hawkins whose hearts will be beating and who will be breathing when their breastbone is sawn open.
That's horrible. Well, I thank you so much for all the work that you've done, for being boots on the ground, for going up there and informing these people and pointing out that, if we have incorrect information within our own government, first off, the trust is gone. The trust has really been totally broken through this whole COVID situation, not only for the medical field, but in the government too. So if we're planning on changing these things, we need people like you who are going to go up there, who are going to tell them, look, these are the steps we have to do, because so many people are just unaware of what's going on, and we're going by lies from the past. And, well, that's what's been done before. That's what's been done before. But doing the same thing over and over again and expecting a different outcome, that's insanity. So we need to stop the insanity and start making the changes. And I commend you for doing such an excellent job on doing that. And I'd like to tell everyone that you can be followed on X at Heidi Klessig, MD. And your website is respectforhumanlife.com. And your book is called The Brain Death Fallacy, and that can be found on Amazon. And I want to thank you again so much for coming and doing all that you've done. Is there any last words you'd like to say before we let you go?
Oh, thank you so much, Greta. I want to just tell your viewers, nobody likes thinking about death. Honestly, you don't. But it's important that you look at this information now, because if you wait And there you are on the worst day of your life in a hospital room, looking at, a family member, a child on a ventilator, suddenly being confronted with this, that it's too late. You won't be able to understand what the right thing to do is. So please go to the website, check out the social media account at Heidi Klessig MD on X, and get the information now so that you can make the right decision for you and your family.
Yes, be prepared. Thank you so much, and God bless you, and keep doing God's work.
God bless. Thank you.
All right. I want to thank everyone for joining us tonight for another show of Medical Mafia. Please share this show out to everyone because I've got some amazing information from this. I still had so many more questions, but it's people like Dr. Klessig that just, are full of knowledge and things that you're not going to find accurate information when you Google it. Because believe me, I thought I gave myself brain damage trying to find out some of the answers on there, and she cleared up a lot for me tonight. So please get that information out there to everyone. We need to share this. We need to be the watchman for other people. If they accept it, great. If they don't, you can say, well, I did what I was supposed to do. I did what I was called to do. And I want you all to know that you can also follow me on X for daily updates at Protocol Kills. And you can sign up for monthly emails at protocolkills.com. I try to send out maybe 1 or 2 emails a month. And that's it, because I absolutely despise spam and I don't have enough time to put out spam. So not saying that y'all aren't worthy of my spam, but I just don't want to. So whenever I email people, it's usually with important information about shows or great guests like this that have really valuable information. So if you want to sign up for that, great. You can follow the Street Talk Network on Rumble. They have live shows every Thursday here, and they're all, we have different topics and they're all informative. And don't forget to donate to streettalknow.com to keep this type of information coming to you. And stay with us because Stiletto has prepared another great outro. And good night and God bless everyone.